Girl got another delivery. Let's talk about it, okay? So, tomorrow will be exactly 1 month since I started Sermorelin journey, you guys. So I'm so excited that it's been a month. I pretty much want to come in and do a month review of how I'm feeling and all the things about Sermorelin. So, first of all, if you don't know me, I'm Erica. I've been on a weight loss journey, 2.5 years, GLP-1, Bio Boost, Lipo B and C, and now I've incorporated Sermorelin to my journey. And your girl is doing amazing. I'm down 65 pounds. I've been in maintenance for a year and a half. I'm at my weight this morning is 100. I've been maintaining about 139. My goal weight was 150, and I'm over 10 pounds under my goal weight. So I'm definitely not trying to go any lower than that. So 140 is my good soft spot. So I'm good there. I don't really want to go under that, but I'm super excited about the process, just the whole process, and all the things. And so I always love sharing my story with people. And I literally just got to talking to a friend of mine, an old friend of mine, and she was asking me like, "Where's your update for your Sermorelin?" So to know that somebody's waiting to see it, and people are really watching and paying attention and interested and want to know about it and how to get it and all the things. And you guys know I'm not a gatekeeper. I'm always sharing knowledge. I'm gonna make sure you guys know everything I know. And so I'm just so grateful to be able to help so many people. And so I also just got an inbox from a company that's asking me they want me to become an affiliate with them. But I don't think I want to do any more affiliations with any products for the most part, at least not weight loss products. I just haven't had a good experience with that. But Shared RX, I'm not sure if you know them, but they did and just reach out to me and ask me about, I guess they like the way my videos on Sermorelin and all the things, and was asking me if I would be interested in collaborating with them to, I guess try their product and all the things. So I'm currently getting Sermorelin from Amble Health. So that was my first time trying Amble Health. That's who this package is from, and so that's been going well. So this is actually my third delivery, which I'm going to tell you why I got another one so soon, because I literally been on it a month. I just started the new vial. I took it out the freezer. So basically, when you if you're not using the vial at a time, you're supposed to keep it in the freezer until you're ready to use it to preserve it. So I had it in the freezer and I took it out, and so I just took the first dose from it yesterday from it. But I get that from Amble Health. My GLP-1 I get through so crazy. Enbold is my telehealth provider. So all my GLP-1, I'm on name brand Manjaro, that all comes from Enbold. My Lipo C, which is MIC injections, which is Lipo B and C, comes from Enbold, and they are the GOAT. I just love everything they stand for over there. But I didn't even think to try them when I initially decided to do the Sermorelin journey. As my friend Sharon was doing it, and she got it from Amble. I didn't think nothing of it, so I don't even know if Amble has it. But I am, so far it's going well. I don't have an issue with getting it from Amble. I'm not, affiliated with anybody specifically. So I have, initially the first supply that came out took a little while to get here. I'm gonna say at least it took like about a week and a half to 2 weeks before I got it. But going forward, ever since then, I've been getting, maybe it's just a whole processing as a new patient, because everyone after that has been coming pretty quickly. I'm gonna add the date add when I ordered this and how fast it came. So I actually didn't order this. This came as an auto refill, so it automatically refills. So basically, when I first got the first order, because it took so long, I went ahead and reordered it, and the second vial, and that's why I'm just getting into it. I wouldn't have ordered the third one so soon, but I didn't realize that you have to go on the website and put a pause in if you don't want it to automatically refill. And I didn't think about it. I knew that Sharon even knew me that I needed to pause it, but I didn't think about it. And so before I knew it, I got an alert that they had to bill me for it, and it was on the way. And speaking of billing, it's for a month supply, $159 for a 30-day supply. Okay, and I'm going to show you what's all in the box, but I didn't know. I forgot to pause it, so I literally went in there and made sure I paused it. Now you can pause it for 1 month or 3 months. I think I did pause it for 3 months, so I can go in and order it when I need it. So it will auto refill it. So make sure if you're not wanting it automatically refill that you do that. So now going forward, I probably would be okay with them automatically refilling it, but because I didn't know that they would get it to me so quickly. So yeah, I'll go in and order it next month, and after that I'll probably just start letting it auto refill. But yeah, your girl is on Sermorelin. Let's talk about it. Let me just tell you, for those who don't know Sermorelin, the benefits of Sermorelin. So it helps it reduces wrinkles, increase muscle mass, it reduces body fat. That's one of the good goals for people, especially people who are trying to lose weight, okay? Because the girl ain't trying to lose no weight over here. But I did drop a couple pounds when I first started it. But I have stayed out now, just so you know. Decreased joint pain, which is huge for me, which is one of the biggest reasons I had it. And then also tummy fat, just trying to get this down, which I think is doing much, much better. Improved heart health, improved body composition, which getting that body shape and all the things. And it's doing good. All that is happening, it's doing good. And then improved energy and increased sleep. And I'm telling you, the sleep is there. So that's what, and that, so just so you know, Sermorelin is a peptide, and it's like, it acts on the growth hormone, I'm trying to remember the name of G, yes. Anyway, the growth hormone, which we pretty much produce as kids. Anti-aging, I forgot to tell you, anti-aging, which you said reduce wrinkles, but but it reduces, so as kids we have, we automatically put out that hormone. As we get older, especially my age, I'm 53, that doesn't happen. So these things kind of make your body, trick your body into thinking, doing all the things that it would do when you're younger is how it kind of works on your body. So all together, this stuff really works. And I get a question all the time, like, are you taking all those together? Yes, all together, no issues. I haven't had any problems. Now the Sermorelin is, the injection is 5 to 7 days a week. So that's an adjustment, because right now I do the GLP-1 once a week, and then I do the Bio Boost, which is make injections. I do that once a week. Now this one's 5 to 7 days, so you don't need any more. It's up to you if you want to do 5 or 7 days, but it's all subcutaneous injection in the belly, in the fat, wherever you can pinch the fat from. But I've been doing amazing, and I do feel overall so amazing. My joints feel better. I'm still, now listen, keep in mind that a lot of the benefits that I'm going to really see usually takes about 1 to 3 months to get those benefits. So I'm still in the early stages, but the sleep is 100% there. And I'm definitely feeling a lot better in my knees now. Some days it's worse than others. I still could tell I got more room to hopefully get better. But the girl is feeling amazing, y'all. So I just want to come in and kind of give y'all like an update of how I'm doing. And if you can take them all together, yes, I'm taking them all together without no issues. I'm sleeping good, all the amazing things. So let me just open this up so I can show you what it comes in the box. Let's see. Listen, all I know, your girl 53, and I'm trying to live my best life, stay as young as I can, get this blood pressure. Your girl feeling amazing at 53, and I'm just trying to live my best life. Like, I'm so okay. So anyway, this is, so if you don't need it to use it right then, it should be kept, it definitely should be refrigerated, okay? And it has to be frozen if you got extra. Like, now I'll put this in the freezer, okay? Because I literally just opened up the new box, okay? So we got a cooler. And we use these coolers. The girl getting outside doing nature, so we learning how to go crabbing and all that stuff. So we be using these coolers today. So thank y'all for the cooler, because we be using this for our bait and stuff like that. And we just, whatever. This is a cooler that you can actually use again. So here we go. Let me open it. Let y'all see this good. Hold on. Let me open it a little bigger for y'all. Okay, so we got, of course, y'all see the ice. Okay, and there's the ice. We're gonna pull that out of there. And then we got this. And then we got another bag of ice, okay? So I'm gonna put the ice back and I'll show you what's in this package. Alright, let's see what we got here. For those who don't know, but yeah, I'm so excited to be sharing my journey. Y'all listen, even not just, I'm getting inboxes about my Sermorelin, and people who actually got turned on to Sermorelin, got turned on to B12. Like, your girl is a whole influence out here in these streets, and I love every minute of it. So here we go. This is your vial here of the Sermorelin. I'll make that where you can see it better in a sec. Hold on. Let me go back. Yep, there's my address right there. But hold on. I can see it good. There you go. And that's the, you can see, hold on. And there's the, let me let you see the name. Sermorelin, 2 milligrams, 5 ml. So I'll show you all that. It's definitely, so they say no refill, but there's some, they do give you, hold on y'all. When I got the when I got signed up with Amble, I did have 5 refills on there. So they automatically initially start you off with 5 now. So I'll figure out how that goes forward. But I got enough of all these. So this is, because it's 5 to 7 injections a week. You're gonna get 3 bags of needles. These are subcutaneous needles. They're very little. I had a friend, one girl, she in one of my groups, she just inboxed me that she just got her delivery for her make injections like OBC, and she afraid of taking injections. So I was trying to tell her, like, get somebody in the house to give it to you. I don't trust nobody. I'll go on YouTube first. Like, she's like, no. But there are people who really are afraid of getting them. But once you get used to it, I just say tell people to clean the site really good with alcohol. The injection is given on a 45-degree angle, and I just mean like you stick in the side of a triangle. That's kind of that's the angle that you're gonna go in when you get ready to give the. This is the needle, y'all. I want y'all to see. Okay. It comes in it comes in 100 units because this is like an insulin needle, or it equals 1 milliliter there. See? Okay. But this order is for they say initially 10 units and then up to 20. But you take 20 units is the order for so you're literally gonna draw up about right here 20 units, and that's the dose that you give. That'll be continued on. Okay. 5 injections. Some people take the weekend off. You can do Monday through Friday. However that works for you. You can take the whole 7 days if you want. For me, the first week I went ahead and did a full week of 20 units. Well, I started with 10 though, because I wanted to get my body used to it. And then now I do probably about 5 days of it. Okay. So that's what the needle looks like. Let's look at the vial here. Again, I was going to tell you, so 45 degrees, pinch the fat, and you want to go in on a 45-degree angle, and then you want to make sure you clean the site. You want to clean the vial first, clean your stomach area, wherever you're going to inject, and then give it on a 45-degree angle, which is, I just say, like you stick in the side of a triangle. That kind of helps you. And it's going to be a little pinch, of course, but you'll get used to it. I'm just saying, you know, the benefits outweigh the complications, okay? So, yeah. No side effects that I have seen at all. Side effect I get is the good sleep, which is a good side effect. Okay, so here we go. Coming out the vial, coming out the thing here. So y'all see that Sermorelin. That's it with the green label there. And then this is the top. This is called the stopper here. So when you take it off of there, I'm not gonna take it off because I want to make sure I'm gonna put it in the freezer. But I want to make sure that you know to clean that. This phone acting stupid, y'all. I want to make sure that you clean the top because you want alcohol. You don't want no risk of bacteria transferring into you, okay? So clean everything down. When you're done, clean it again. Clean your stomach area or wherever you're sticking it again, okay? And also they give you a card on how to take care of all the good things about it, subcutaneous injection guide. So it tells you. So they give you what you need. This stuff, mine came from Boothman Pharmacy. And it kind of tells you how to go in there and do all the things, okay? How to take it and clean it. I'm saying that I just said all the things. If y'all don't know, I'm a nurse, so clearly I know how to give injections. But for those who don't, there you go. It's all here. It'll walk you straight through all of that. And I do I think the belly is the least painful area. You can do the back of your arm, but here they show you here all the sites you can use here. But I'm just saying, we're gonna keep it simple as they can, okay? And then you also get all your little alcohol pads. So this sets you up, okay? So far things are going good. I haven't had any issues with Amber. Initially I was pissed a little bit, only because I didn't know what was taking so long. But there you go. That is the update on my Sermorelin. Everything's going good. I'll keep you posted. I'll keep you updated and let you know how things are going. One of the things I really was concerned with, because I have what you call like a fupa area. It's so much better, y'all. Like, let's see if I can show y'all down with these black shorts, but it was so much. And your girl body is really like, part of what it does is contour your body, so I feel like it's helping to get it, you know, that shape and get everything organized. Lipo kind of helps that too. I just think all of these meds together kind of work together to give you the most best outcome. So check it out. If you have any questions, list them below, and I'll talk to y'all later.